If you're experiencing balance issues, dizziness, or vertigo, there may be something that we can do for you. At LifeMark Neurologic Physiotherapy, we do evaluations, thorough evaluations, to identify and treat different kinds of conditions. Some conditions might be more peripheral, like coming from your inner ear where your vestibular apparatus is, and some conditions might come more from the processing of vestibular information, such as in your brain. There are different conditions like coming from an infection, vestibular migraines, or even integration of how vestibular issues and vision issues or proprioceptive, which is where your body is in space, can collaborate. And so all of this can come into light when we do a thorough evaluation. At first, in the appointment, we'll do a very thorough history and we'll test very, very specific things, either using infrared goggles or without, and we'll look at eye movements, motion of your head in space, and determine whether it's coming from the peripheral systems or coming from the central nervous system and the integration of vestibular information in that case. Our goal in the evaluation might be to reproduce some of the symptoms, but we also really listen to where you're at and how you're coming in on the day of. There might be times where a client comes in and they're very, very sensitive, and even just a little bit of movement might cause them to feel very, very ill for several days. And so we listen and we tailor the assessment based on your needs. After the assessment, we should be able to explain and give you education on what we think the potential problem or problems may be, and then guide you into what would treatment look like. It may involve a lot of education, understanding your body a lot better. It may involve exercises and even some things like mindfulness or management strategies to differentiate the different symptoms and make sure that you are able to react better in certain conditions. In any case, the feedback that we get from our vestibular patients and clients is that we're very thorough, that we educate very well, and that we give them the tools for them to take on their own symptoms and their own progress through their healthcare journey.